When you look at the management pharmacologically, what kind of medicines are we looking at? I think you mentioned one earlier.
Yeah. So, in general, medications for both depression and anxiety are called antidepressants.
Mhm.
Okay. And typically, we use what's called an SSRI or an SNRI.
Mhm.
And obviously, you know the difference between the two. I don't know if you want to talk about the difference a bit.
Yeah, I mean, I think, when you look at major depressive disorder and you
Mhm.
look at the brain, I mean, the simplest way I've ever heard it explained is it can be a disorder of some of the neurotransmitters, right? And the major neurotransmitters we're talking about here are norepinephrine, serotonin, and dopamine. And a simple way to think about these neurotransmitters is that norepinephrine is kind of that drive to do something, to get up and go and get something done. Serotonin is that feeling guilty or not guilty or something like that, some feelings as like that. And then dopamine is that pleasure type of feeling, right? When you have a lot of dopamine around, you find pleasure in whatever it is that you're doing. And so you have this imbalance that's taking place in some of these individuals. And so you have lower levels of serotonin or dopamine and norepinephrine.
Mhm.
And so when we say SSRI, we mean selective serotonin reuptake inhibitor. So instead of serotonin going back into that neuron, it stays out at the synapse to continue to allow the neuron to fire like we want it to fire, right? When we say SNRI, we mean serotonin or norepinephrine reuptake inhibitor, right? And so then you get both the serotonin increasing and the norepinephrine increasing, and then you also have medications that increase dopamine as well. And so all of these chemicals basically have a function in your body. Now, it's not that simple because even when you treat individuals, it's not like as soon as you treat them, they're better.
Yep.
It takes weeks.
Mhm.
And, depending on who you're talking to, some scientists believe different things. They believe that your neurons got to reset and they have to, once they reset, then you get those transmitters increasing in those synaptic areas. And that's what happens. Who knows? But it's not as simple as that, right?
Right. And you make a good point that I always tell my patients, when we're starting you on a new medication, give it a few weeks. We're not going to know if it works until at least 4 to 6 weeks.
Yeah.
So it's definitely, there needs to be education.
Right. When you prescribe this for individuals, do you think about which one's going to work, or do you just have a go-to? I'm doing Lexapro, for example, or I'm doing like how do you approach that?
Yeah. So I think every doctor probably has their list of favorites that they, are comfortable prescribing that have a great, response usually and low side effect profile.
Yeah.
You always want to minimize side effects whenever possible. So there are definitely some antidepressants that are better for people who have more depression, whereas there are some that are better for people who have more anxiety.
Yeah.
So I usually go from there based on their needs.
And when you are thinking about prescribing them medication, I know that you think a lot about the patient holistically. And I know you think about metabolism of certain medications, and there's a certain test that you're ordering to make certain that the patient can handle the medication you're giving them. What's that test?
Yeah, so it's a really cool test that I offer at my practice called a gene site test. And it's really cool because a lot of times patients will have some reservations about starting this medication. How's it going to make me feel? I've heard bad side effects. Well, with the gene site test, it's just a simple DNA swab
Hmm.
and it actually analyzes almost any antidepressant that you can think of to your DNA to see which medications will cause the least side effects and also which ones that you'll likely do better on at lower doses. So you're not having to, titrate up the doses.
Yeah, when you look at this test, what this test is actually doing, the way medications are eliminated in your body is typically speaking, your liver's going to break them down. Sometimes your kidney breaks them down, and it'll either put it in your bowel or it'll put it in your urine, and then you'll pee out the metabolites. Now, when you look at this test, what this test is actually testing for is it's testing for the presence of certain enzymes or it's testing for the presence of certain types of cellular activity to make sure that the medication is broken down in a certain way, shape, or form And if it's not, if a red flag comes up, it's going to let you know. It's going to say, hey, listen, use with caution. Or the test will say, hey, listen, you really probably don't want to use this medication. And it's all based on how these medications are going to be broken down within your system, which
Yeah.
I had just heard of this test recently, and it seems to be a pretty nice test.
Yeah, it's really useful. It won't tell us, exactly what medication is going to work best for your symptoms, but at least we can try to minimize the side effects.